Hi guys, and welcome back to Nurse Nikki Chronicles. So today we're gonna talk about the silent killer. And you're like, the silent killer, what is that? Okay, so that is another term name for hypertension or high blood pressure. And that came about because there are a lot of people that are walking around with really high blood pressure, like 180, 190, 200s for the systolic, which is the top number, and their bottom may be 96, 100, 120. Those are really high levels, and they don't feel bad at all. They feel good and fine. But that's because the body has already compensated for those levels being so high. So they had to been running those levels for a good long time, and the body is just adjusted and got used to, working harder and pumping. But that is still not good at all because you can get a lot of other complications such as heart disease and even stroke. Okay, now with stroke, things you should look for is facial drooping, slurred speech, arm weakness, loss of balance and coordination are some things. If you notice those in anyone, please, that is an emergency situation, get them to the nearest emergency room as soon as possible. The big thing with the stroke is the time. You want to make sure they get treatment as soon as possible to prevent further complications. Now, with hypertension, for years and years, we've always known that 120 over 80 has always been the baseline for your blood pressure. Now, I've heard some things about them lowering it, but we've always known 120 over 80. Okay? Now, and also with your heart rate or your pulse, 60 to 100 is normal range, just to give you another little fact. So, it's good to check your blood pressure at Walmart and a lot of the pharmacies. They do have blood pressure machines. I know I bought my mom one. It was like $24 at Walmart, and it's one that has a cup. Some are cheaper, some are higher, depending on the brand and what you get. They do have some that you can use on your wrist. Um, and I know some people may like those, but I have heard that the wrists are not as accurate. But whatever floats your boat. Um, but it's good to know what your blood pressure is and how you usually run it. Now, some factors that can increase it. If you're like, well, I'm usually normal, but today I'm just high. If you're having pain, that can increase your blood pressure and your heart rate. If you were just going to the doctor's office and you was rushing to get there, or you do some exercise and stuff, that'll cause things to go up as well. So there's just something to be mindful of, or any anxiety, it can do have an effect on your blood pressure or heart rate. Now, for the diet and things to look out that can help. You may have heard about the DASH diet, or maybe you haven't. It's just basically a low sodium, low salt diet. They do have Mrs. Dash seasonings that you can get from the grocery stores or Walmart. And so it has your flavor seasonings like garlic and onion, pepper, but it doesn't have the extra salt and sodium in it. And you can use those to season your food. Also, be mindful of some foods that are really high in sodium and salt, like pork, so bacon and ribs and things of that. Drinking lots of water. Water. I know you always hear that all the time, but that's because your body is composed of at least 80% of water. So you need to drink lots of water. It helps with weight loss. It helps flush out the toxins out your body. So water is really good. So that helps a lot. And what is it I want to tell you? Okay, so if you are prescribed any blood pressure medications, it is good, imperative that you do take your blood pressure pills. That doesn't mean that you'll have to take them, forever. But you need to get your levels controlled. I know when my mom fell out a couple of years ago and her blood pressure was really high, she was placed on blood pressure pills. But now she doesn't have to take them, but we do check to make sure her blood pressure is fine. Okay, so just because you're a starter, that doesn't mean you may have to stay on it forever. It just depends on your particular condition. But just be mindful that if you are started a treatment regimen, try to comply to at least get your body back at a healthy level and state. Okay, and also for the men, I know a lot of men, they be concerned because a lot of the side effects, and it can affect their manhoods, their private area, penis. They may have some issues due to taking blood pressure pills, so a lot of them don't want to take it. but it is good if you keep it, your blood pressure controlled. This is a big thing, okay? And I think that's everything I really want to tell you guys about, the blood pressure. But thanks for watching. Thanks for tuning in. Again, I am Nurse Nikki. This is my Nurse Nikki Chronicles YouTube channel. My IG is RNQD. I put snippets on there. This video is a little longer than normal, but I just want to come in quickly and give you some little facts, little information, little tidbit on hypertension. All right, so talk to you guys again soon. Bye.